Homeostasis. Blood, blood must be maintained in a fluid state in order to function as a transport system, but must be able to solidify it to form a clot following vascular injury in order to prevent excessive bleeding, a process known as homeostasis. Successful homeostasis is localized to the area of tissue damage and is followed by removal of clot and tissue repair. This is achieved by complex interaction between the vascular endothelium, platelet, bone ulivan factor, coagulation factors, natural anticoagulants, fibrinolytic enzyme. Dysfunction of any of this component may result in hemorrhage or thrombosis. Platelets are formed in bone marrow from megakaryocytes. Megakaryocytic progenitor cell colony-forming unit megakaryocyte divided to form megakaryoblast, which undergo a process called endomitotic reduplication. In which there is division of the nucleus but not the cell. This creates mature megakaryocyte large cell with separate nuclei and cytoplasm containing platelet granule. Large number of platelets then fragment from each megakaryocyte into circulation. The formation and maturation of megakaryocytes is stimulated by thrombopoietin produced in the liver. Platelet circulates for 8 to 10 days before they are destroyed in reticuloendothelial system. Some 30% of peripheral platelets are normally pooled in the spleen and do not circulate. Under normal condition, platelets are discoid with a diameter 2 to 4 micrometer. The surface membrane invaginates to form tubular network. A canalicular system which provides a conduit for discharge of granule content following platelet activation. Drugs that inhibit platelet function and thrombosis include aspirin, the cycloogenase inhibitor, clopidogrel, pasugrel, ticagrel. Ticagrel adenosine diphosphate ADP mediated activator inhibitor, dipyridine phosphodiesterase inhibitor, and esigimab, tirofiban, ft-fibatide, which prevent fibrinogen binding to glycoprotein 2b3a receptor alpha 2b beta 3 integrin. Clotting factor. The coagulation system consists of a cascade of soluble inactive zymogen protein digested by Roman numerals. When proteolytically cleaved and activated, each is capable of activating one or more complement of cascade. Activated factors are designated by suffix A. Some of these are reaction required phospholipid and calcium. Coagulation occurs by two pathways initiated by extrinsic tissue factor pathway and amplified by intrinsic pathway. Clotting factors are synthesized by liver, although factor 5 is also produced by platelet endothelial cell. Factor 2, 7, 9, 10 require post-transitional carboxylation to allow them to participate in the coagulation. The carboxylase enzyme responsible for this in the liver is vitamin K dependent. Vitamin K is converted to an epoxide in this reaction, must be reduced to its active form by reductase enzyme. This reductase is inhibited by warfarin, and this is the basis of anticoagulant effect of coumarin. Inherited hemophilia and acquired liver failure causes coagulation factor deficiency are associated with bleeding. So we can now see the pathway. This is vascular endothelium. Vascular endothelium can release nitric oxide, prostacyclin, heparin. Nitric oxide, prostacyclin, heparin. This is platelet. This is red cell. And this is vascular endothelium. Under this subendothelial collagen. If vascular endothelium injured, then activation of some factor like GP1A bind collagen, and GP1A bind to collagen, and when GP1A bind to collagen, GP1B bind to von Willebrand factor, is activated platelets, and GP2B3A fibrinogen, and tissue factor, coagulation activated by tissue factor thrombin. We can see now intrinsic factor and extrinsic factor. First of all, activation of coagulation factor by tissue factor, activation of tissue factor pathway. And tissue factor activate thrombin activate intrinsic pathway, then intrinsic pathway activate thrombin inhibition of fibrinolysis, then activate tissue factor 1A and factor 8 activator, thrombin clot stabilization, cleaves fibrinogen proteins, thrombin receptor platelet activator, thrombin platelet activator, thrombin receptor activate protein C pathway. So we can stage 1 free injury condition encourage flow. Vascular endothelium produce substance including nitric oxide, prostacyclin, heparin to prevent adhesion. Vascular endothelium produce, first we can talk that vascular endothelium produce prostacyclin, heparin to prevent adhesion platelet and white cell vessel wall. Platelet and coagulation factor circulate in non-activate state. Stage 2 early homeostatic response. Platelet adhere, coagulation is activated. At the site of injury, endothelium is breached, exposing subendothelial collagen. Small of tissue factor are released. Platelet binds to collagen by a specific receptor glycoprotein 1A, causing a change of platelet shape and adhesion to the area of damage. By binding other receptor glycoprotein 1B and glycoprotein 2B3A, 1B to von Willebrand factor, 2B3A to platelet factor and fibrinogen respectively. 1B von Willebrand factor and glycoprotein 2B3A fibrinogen respectively. Coagulation is activated by tissue factor or extrinsic pathway. Generated small amount of thrombin. Fibrin clot formation. Platelet become activated and aggregated. Fibrin formation supported by platelet membrane. Stable fibrin clot forms. The adherent platelet are activated by many pathways including binding to adenosine, ADP, collagen, thrombin, adrenaline, epinephrine to the surface receptor. Cyclooxygenase pathway converts arachidonic acid from the platelet membrane thromboxane A2, which causes aggregation of platelet. Activation of platelet results in release of platelet granule content and hence coagulation further. Thrombin plays a key role in the control of coagulation. Small amount generated by a tissue factor pathway massively amplify its own production. The intrinsic pathway becomes activated and large amounts of thrombin are generated. Thrombin directly causes clot formation by cleaving fibrinopeptides from fibrinogen to produce fibrin. Fibrin monomers are cross-linked by factor 8, which is also activated by thrombin. Having had a key role in clot formation and stabilization, thrombin then starts to regulate clot formation to main ways. Activation of protein C pathway, a natural anticoagulant, which reduces further coagulation. Activation of thrombin-activated fibrinolysin inhibitor, which inhibit fibrinolysis. Limiting clot formation, natural anticoagulant, reverse activation of coagulation factor once homeostasis has secured. The propagation of clot is curtailed by anticoagulant. Antithrombin is a serine protease inhibitor synthesis by the liver, which destroys activated factors such as 9A, 10A, and thrombin 2A. Its major activity against thrombin 10A is enhanced by heparin and fondaparinux, explaining their anticoagulant effect. Tissue factor pathway inhibitor proteinase cleaves 5A, 8A. Protein C, protein S are vitamin K dependent and are depleted by coumarin anticoagulants such as warfarin. Fibrinolysis, plasmin degrades into fibrin to allow best cell recanalization, tissue repair, the insoluble clot to broken down best cell recanalization plasmin. The main fibrinolytic enzyme is produced when plasminogen is activated by tissue plasminogen activator or urokinase in the clot. Plasmin hydrolyzes in the fibrin clot producing fibrin degradation product include D-dimer. The process is highly regulated. Plasminogen activator controlled by inhibitor. Plasminogen activator inhibitor. The activity of plasmin is inhibited by alpha-2 antiplasmin, alpha-2 microglobulin, and fibrinolysis further inhibited by thrombin activator and tissue activator fibrinolysis inhibitor. Tissue factor extensive pathway, tissue injury tissue factor, factor 7, then factor 7 activated, tissue factor activated factor 7, then 10, factor 10 ki 10A, factor 10A, common pathway, then factor 5A, 5A, prothrombin ki thrombin, thrombin activated, factor 9 to 9A, and factor 9 activated factor 11 to 11A, factor 9A to 9, factor 9 to 9A, then factor 8 to 8A thrombin এবং factor 10 to 10A, factor 5 prothrombin thrombin. Implication coagulation pathway. Tissue factor pathway inhibit tissue factor pathway inhibitor, tissue factor pathway inhibitor, factor 10 to 10A, intrinsic pathway, factor 5A, prothrombin to thrombin, antithrombin inhibit thrombin, action of thrombin, activated protein C, protein S, factor 5A, factor 8A inhibited, natural anticoagulant regular protein C, protein S. Tissue factor inhibitor, the fibrin degradation product, tissue plasminogen, urokinase activator plasminogen. Plasminogen activator inhibitor, plasminogen activator inhibitor, plasminogen, plasmin, alpha 2 macroglobulin, alpha 2 antiplasmin inhibitor plasmin. Normal platelet structure is populated by glycoprotein. platelet glycoprotein which bind to key structure including fibrinogen, collagen, bone-Ullmann factor, fibrinogen, collagen, bone-Ullmann factor, and cell surface receptor, thrombin, ADP, adrenaline. Through internal signaling pathway, platelet activity causes the degradation of alpha and dense granule, which ultimately result platelet aggregation. Blockage of this pathway by drugs such as aspirin, clopidogrel, ticagrelor, tirofiban, ezetimibe forms the basis of antiplatelet therapy.